Good afternoon. Hope everyone's doing well. I'd like to call the special meeting of the Board of County Commissioners to address emergency management related to COVID-19 and the local state of emergency meeting to order. Before calling the roll, I want to read into the record from Commissioner White. It says, I am unable to attend today's special board meeting of the County Commission meeting due to unforeseen circumstances. Please read this reason of my absence to the record. Please call the roll.
Good afternoon, Miller.
Here.
Hagan. Commissioner Hagan. Kemp.
Here.
Merman.
Here.
Overman.
Here.
Smith.
Here.
White is absent. County Administrator Wise.
Here.
Thank you. You have a quorum.
Thank you. We're now moving to public comment. The Board of County Commissioners welcomes comments from citizens about any issue or concern. Your opinions are valued in terms of providing input to the board. However, it is requested at the same time when you address the board that comments are not directed personally against a board member, a staff member, or a presenter, but rather directed at the issues. This provides a mutual respect between the board and the public. 20 minutes have been set aside for public comment. Each speaker has allotted 2 minutes. Our first speaker is Jeffrey Kane.
Thank you. Jeff Kane, calling today to respond to some BOCC members who have asked when we can end the COVID-19 emergency. Well, the CDC quietly published admitting that many of us have known or suspected that only 6% of the total reported deaths with COVID were actually due to COVID-19. Thus, 94% died of an average of 2.6 causes due to having compromised immune systems, explaining that the median age of COVID death is 78 years old, which is 78 is also our average age life expectancy. Thus, again, saying that we need to keep our seniors safe. But as the data shows that 99.98% of those that are healthy fully recover from COVID, which is much higher than the rates for the flu, pneumonia, and of course cancer. Thus, the COVID-19 numbers being reported are corrupted, as my brother, who is the head of a doctor of a COVID clinic, said that he and other doctors are afraid to speak out about these corrupted COVID numbers that you are being presented with for fear they will be fired. My brother explains the CDC keeps changing their protocols, which have inflated the numbers, not only the death totals, but also the positive case numbers were inflated to cause the second wave by first corrupt labs like Quest Diagnostics holding back cases and then dumping them, but reported as new cases. And the CDC then instructed clinics like my brother's to perform multiple tests on a patient, saying that the tests were, quote, not reliable, but each multiple test of one person is counted as separate new cases. Then people to be cleared of COVID are tested daily, and each of these tests often counted as new cases until they finally get 2 negative cases. Now, since case numbers are going down, now they're going to test daycare centers, try to find another new source of positive cases. When will the nonsense be brought to an end to stop the fear? So please vote to end the emergency to free our county and end the mandatory masks that are just allow people who want to wear masks to do so as they see fit. Thank you very much.
Anthony Davis.
Yeah, thank you, Commissioner. My name's Anthony Davis. I'm a resident of Hillsborough County now for 21 years. My wife as well. It's my wife. I want to speak to the lens of really children in these comments. My wife practices dermatology and has done so for over 20 years in both Hillsborough and Pasco County. Just to incite, you all of what she is seeing in her practice alone, and some comments from colleagues that she is, that she has, that has also seen a rise in contact dermatitis in the younger generation that are forced to wear masks now, especially now that school has started, even though it's been a very short time. So in a very short time, she's seeing increased cases in both contact dermatitis. And although she has not seen personally cases of impetigo, some of her colleagues have. This is directly attributed to the fabric masks that are being worn all day long during school, creating a moist barrier. As you all maybe have read, there have also been cases of reports of in the local area of antibiotic-resistant staph in the lungs. Again, all of this related to the mask mandate. echoing what the previous commenter said, I think this really is up to the individual. You know, as far as I can tell, you know, the board, the commissioner and the board here are not medical practitioners. You guys are making decisions based on, you know, questionable data. Things are coming out every day. And I think it's really time to end this emergency and really put this into the hands of the citizens who choose to wear a face mask or not. Thank you.
Diana Klein, I'm sorry.
Yes, thank you. It's Diana Klein. I'm calling on the Hillsborough Board of County Commissioners to not, repeat, do not renew the local state of emergency order in Hillsborough County and allow it to completely expire today and get our county completely back to normal business, because the recovery rate of infected individuals, as shown on the board's dashboard, is over 98.5%, which reveals that the coronavirus is no more dangerous than the seasonal flu. The stats prove there's absolutely zero justification for keeping the order in effect beyond this meeting, and no reason for people to live in fear of coronavirus or any other virus. One of the keynote doctor speakers from your meeting last week stated that it takes a lot of energy to fight off a coronavirus infection. Hence, wearing a mask and social distancing does nothing to help people fight off a virus infection. The solution to a virus infection is to eat healthy and get plenty of exercise. Exercising allows your body to remove toxins and viruses from your body through your sweat. So get some exercise. Also, coronavirus and all other viruses are easily dismantled and destroyed by consuming foods and drinks that are rich in vitamin C, D, and zinc. These vitamins and the mineral zinc provide a person's immune system with the nutrients that it needs to dismantle and kill any and all viruses, bad bacteria, and fungus, and prevent them from replicating in a person's body. Fermented foods and drinks are very rich in vitamin C. Fermented foods as well as bone broth are also very rich in prebiotics and probiotics that provide our bodies with a healthy gut of enzymes that also dismantle viruses, bad bacteria, and fungus. Some examples of fermented foods and drinks are pickles, olives, sauerkraut, raw apple cider vinegar, kombucha, and more. Foods rich in vitamin D include eggs, fish, particularly salmon, mushrooms, unfiltered honey, and more. Foods rich in zinc include garlic, peas, beans, pumpkin seeds, cashews, sunflower seeds, pecans, flax seeds, almonds, cocoa, and more. Everyone is responsible for their own personal health, not the government. Do more research online. Pass this information on to all your friends and family so everyone can remain healthy and free from the coronavirus and all other foreign organisms in Hillsborough County. For God has not given us a spirit of fear, but of power and of love and of a sound mind.
Ms. Klein, thank you very much. Your time is up. Thank you. Hope Kennedy.
Hi, thank you for allowing me to speak again. My name is Hope Kennedy. I'm with the North Tampa Titans, which is a youth football and cheer organization in Hillsborough County. We are still waiting for the commissioners to do something to allow our football players and cheerleaders to move forward with their seasons and with their contact. We have had multiple opportunities to speak to you guys and to Parks and Rec, and everybody keeps acting like they're going to do something, and yet nothing has been done. Lacrosse is out there wearing the same equipment we wear, and they're allowed full contact. We should be too. Our parents want the choice. Please, commissioners, take a look at this and ask your Parks and Rec to talk to you about it. They keep saying they're going to bring it to you, but clearly they're not, because you guys haven't addressed it yet at all. Our kids deserve the same opportunity that everybody else, sports-wise, in the county has, from schools to youth. Please, 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 and thank you.
Our last speaker is Angela Zaldonado.
Thank you, Commissioner. Yes, my name is Angela, and I also represent a youth organization, Football League, the Brandon Broncos in Hillsborough County, and I am on the same page as the last speaker with the Titans. All of these children, including the field across from us, which hosts soccer and lacrosse, are making full contact. Lacrosse come in just as much contact as football does, even less than what cheer does. And our kids are stuck not being able to do what they love to do. We have followed all processes and procedures in terms of even having liability waivers signed by parents indicating that they take full responsibility and hold no one liable if their child was to get sick as a result of playing. In addition, we have not been able to get any direction or hear anything about being able to bring in revenue from our concession stands. There are restaurants open serving hot and cold food, yet we cannot even provide or sell bottled water or closed food in order to bring in revenue. Heat exhaustion is a serious condition that can affect every child out there, but yet we're being told we cannot provide water to them. I think it's utterly ridiculous, and I think a conversation with Parks and Recs needs to happen, because there is no reason why the high school across the street can host football and have full contact, and our children on the other side of the street cannot. We are all in the same county. We are all in this together, and we are doing everything that we need to do for the procedures to be compliant and to allow our kids safely to be able to play. And something needs to be done, because it is just getting ridiculous and just being pushed on the back burner over and over and over. And these kids are upset. They are sad, and they are losing faith in the sport that they love because they can't do what they want to do. So please have that conversation. Please let us bring in revenue, just like everybody else that is now open and moving forward with youth sports. Thank you.
That was our last speaker. So we now move into emergency management update. Mr. Dudley.
Good afternoon.
Good afternoon.
Good. Can you see your slides?
Yes, sir.
All right. During this operational period, we continue to focus on community testing. Last week, Hillsborough County averaged 510 daily tests collected. We continue to see a steady downward trend in demand for testing. Appointments are available tomorrow. You can continue to schedule any testing for any of our 9 sites. Turnaround times are looking a lot better, still around 3 days or so. The initial testing trial for farm workers were completed on Friday, August 28th in Dover. The trial consisted of a pop-up testing site staffed by our mobile testing team and community agencies. The EOC is currently working with the county department, state agencies, and community agencies to develop a strategy to handle mass testing of this population. The state will be providing 2 testing trailers and supplies. The program will run from September through December. On September 4th, this Friday, the state incident management nursing teams are demobilizing from the mobile long-term care facility testing and infection prevention operation in our region. The Florida Department of Health will continue to support mobile testing operations as long as long-term care facilities on a smaller scale, which will continue to be supplemented by our local Hillsborough County mobile teams. Logistics. We have no PPE or testing kit shortages at this time. We have 3 guests in the isolation site, and the community partners continue to carry the bulk testing of our community. We're holding at about 28%. We'll continue to adjust testing capacity in response to increased testing demand and as PPE supplies and staffing permits. This concludes my update. Any questions?
Thank you, Mr. Dudley. I see no questions. We appreciate you very much. Thank you.
Thank you.
Public health update, Dr. Holt.
Good afternoon, Commissioner Miller, Chairman Miller, and Commissioners. This is Dr. Doug Holt, Florida Department of Health, Hillsborough County. Today, we will again review the epi and hospital data. I'll provide a brief overview, and then Mr. Wagner will walk us through the dashboard. I would like to begin first to just address an unfinished business that we had regarding the pediatric report that was requested by Commissioner Overman. I took a look into this. We sort of come full circle. The initial report that was released was a cumulative report of 2 days, and that yielded a very high percent positivity on that small sample. Then they migrated it and replaced it with this is what we were talking about last week, with a rolling 14-day average, and that was around 14%. We now have returned, just recently related, that was been reported, is just the original format, which is now cumulative data again, And as reported, it's 14.2%. So that's kind of where we are and where we were and where we are as it relates to the pediatric reports that are being released. Mr. Wagner, do you have the presentation?
Go ahead, sir.
First slide, please. So looking at our step down, our descent down these steps has stalled. Our rate per 100,000 at now 104 per 100,000 over 7 days is about 210 cases a day. It puts us again squarely into this middle of the orange zone, or as the CDC would describe it, as a sustained community-based transmission that is controlled. Next slide, please. And again, over time, you can see that if you look at the far right side, our last 4 days, we've seen some slight uptick. Next slide, please. Looking at comparisons to our Tampa Bay counties, our neighbors, they have continued to decline. And so all but Polk County are in the orange zone, if you will, and accompanying this, their positivity rate is significantly lower than ours on a 7-day, where we are about 7%, they're at 3%. Not sure exactly why there is such a difference that's happened. Our schools have just opened, but as we mentioned last week, any impact that we expect from that is not going to occur for at least another 3 weeks or so. So we're looking very closely and begun to examine the data. We're going to look at it by our age, race, and zip codes. As we'll look at on the dashboard, we'll note a increase, is an early increase in our older children. And I think just anecdotally, that may be extending up to into the post-childhood years. But I don't have data yet to support that theory, but we are looking at that closely. So the bottom line is we continue to have community-based transmission that requires us or needs us all to continue to perform the behaviors individually and collectively. Once again, avoiding the 3 C's, close contact, crowds, closed space, indoors, wearing face masks. As we opening our schools, these practices are actually even more important than we do them now. It's the only way we can continue to keep our schools with as little virus as possible to protect our teachers, kids, and parents. So we must be super vigilant at this time. It was going to require all of us to get through this. Mr. Wagner, would you now continue?
Good afternoon, Commissioners. Kevin Wagner, Business Analyst, Health CareServices, Department of Hillsborough County. I will be presenting the publicly available dashboard that's on the Hillsborough County website. As indicated, we have a little over 37,800 confirmed test positivity in the community, nearly 563 confirmed deaths related to or cause of or part of COVID, and a little over 30,000 have recovered based upon an estimated rate. The 7-day rolling average of cases, as Dr. Holt indicated, is around 211. That is up in our Salmon area where we have seen an increase as indicated by Dr. Holt. With regard to testing, as discussed before previously, the testing has flatlined or slightly trended downward. And the overall positivity, as indicated, is nearly 7%. That's 6.81%. And that was updated on Sunday, Monday. And this will update again next Sunday, Monday. The overall hospital utilization and capacity is still looking available based upon the TGH data exchange. All the items are in green, so that's positively trending in the correct direction. The case data summary, the IT team has updated a little bit of the look, but it is still the same data as presented before. I will speak to the chart at the bottom. We've identified the event dates such as the state 1, phase 1 and phase 2 reopening, the Hillsborough County mask order, and the state closing the bar closures. As well as the new one, because of the Quest data dump, they're highlighted on the 8/31 data dump for Hillsborough County. On that particular day, as you see indicated, there were 325 cases. When I read the FDOH report, 106 of those were attributed to the Quest data dump. So when we back out that delta, it was still 219. So our average for those 7 days is still around 200, 210, 215, even when we back out the Quest data dump and even including it respectively. The hospitalization trend, first row, middle box. Again, individuals that present at the ED department, visits by week. This has trended downward as reported by the FDOH. So again, the week starting on the August 23rd, that trend is going down. So that's a positive thing for the hospitalizations. Row 2, box 1, the hospital census for inpatient COVID and ICU is again trending downward, where a 7-day average is roughly 217 census, again on the hospital utilization data, as well as the admissions on the box 2 around 15 a day, so on a 7-day average. So again, those trends on the hospitalization capacity, based upon the data exchange, seems to be available capacity. This is the same testing information as discussed before, a slight trendward down. With regard to row 2, the large capacity of testing, we can see on the last 3 weeks the number of tests that have come in and been reported through the FDOH, nearly 21,000, 22,000, and this past current week, just under 19,000. So the trending of the test of being reported to the FDOH has slowed down on the last 3 weeks, as discussed previously. The school-age children one, this is the same chart that was presented, I believe, the last 2 weeks. We took out the shading just to make it lines for easier viewing. The top row is the daily cases by age. Myself, from an analytical standpoint, I'm looking at the far right-hand side, looking at the post-August 23rd, looking at August 29th when the schools reopened in Hillsborough County. So these were spikes rolling forward. So this particular spike that we see on August 31 were most likely due to cases that were already in the process of being reported, not related to schools, but cases already being tested. So this will be something going forward. And then the cases per 100,000 by age group, again, that has flatlined, and we're looking to see from a trending standpoint, will this increase by the school-age children as well, what Dr. Holt has said. And I'll stop there. Thank you.
Thank you, Dr. Holt. Thank you, Mr. Wagner. I don't see any questions at this time, so Commissioner Merman, you're recognized. Commissioner Merman? You gotta unmute yourself, Commissioner Merman.
Got it. Thanks. I want to ask you a question, Dr. Holt. Going into the flu season, which will probably be October sometime, I guess I want to see how can we get ahead of the situation. I mean, we still have COVID. We're going into flu season. Instead of, what happened with us when we got started was COVID hit, and then we were constantly in a reactive mode. And I guess I just wanted to see how we could get in front of it. Is it communications or messaging, or what would you suggest? Oh, God
Yes,
bless.
ma'am.
Thank you. Sorry about that.
Yes, ma'am. Thank you for the question. And again, you are looking forward, and I much appreciate that. I was contacted in the last few days by several of the healthcare facility or systems, and in fact, they ask, and we're preparing a report for the board regarding exactly what you're talking about, how we are going to need to look forward. It'll probably be about 2 weeks per their schedule. Essentially, right now, advising everyone certainly to get a flu shot. We're hoping there'll be advances in testing so they can more rapidly identify people and distinguish between the two. And again, as I think we all know, that if we've lived through the flu seasons each year, the hospitals often get stressed. So they've asked to come work with me and present on their behalf some of the things that they see and are considering.
Okay, that's very good. So you'll come back to the board at some point and give us a report?
Oh, yes, ma'am. Actually,
Okay,
the hospital representatives of the hospital systems will do so. It'll probably be
Okay.
right now, we're working with their schedule about 2 weeks.
And of course, the hot news today is, my second question is, what was on the news this morning, that there's going to be a vaccine available and the CDCs are contacting regions to have them get ready. Have we been contacted, or have you heard anything?
Oh, yes, we've definitely heard about it. It's been widely reported, Florida, we were told to prepare to receive and distribute vaccine that could be as early as November.
Okay.
Very, very simply, we were tasked sort of to hope and prepare for the best possibility. We've got many, many unknowns right now. They gave us 3 fairly detailed documents that we are working to be prepared to receive and store, handle, potentially a very unique type of vaccines. They're very different from any that we have used in the past, and begin to look at potential populations, community partners, and providers to connect with. So it's all very appropriate pre-planning for whenever that happens, and I'll stop there.
Okay, so you'll let the board know when that happens? I guess, I'm sure you will.
Certainly.
Okay, and thank you for all you do. I really appreciate it. I know you're working hard to keep us safe. Thank you.
Dr. Holt, can I ask a question to piggyback on what Commissioner Merman just asked? Because the CDC is saying that they possibly have a vaccine by the 1st of November, but then you have other healthcare infectious disease experts saying that is not the vaccine that they're looking at, is coming out too soon. There's no proven record of it, but yet they're saying that we should be looking at a population to get this vaccine, when you have half of the other infectious disease doctors saying we should not be doing this. I don't want to put you on the spot, but it's kind of putting all of us in a bad situation if the CDC saying, yeah, we want to have this vaccine out by November 1st. Florida, you're going to get it. We want you to get a target population to take it. Then that target population is hearing Dr. Fauci and other experts saying, don't do that.
Yes, as I mentioned, there is a lot of unknowns. The way this process has worked has been extraordinarily accelerated. And what will be important is to look at the studies and the data that is going to come before the FDA to actually endorse it in some manner, probably an emergency use type. And you really got to dig into the details to decide who's appropriate, who's best, and those are unknown right now. Vaccination should be a decision that is made in coordination with your providers or medical, and I certainly would ask mine. But it's really going to depend on what we see. What's the probability by that date? I don't have an idea, but more to come.
I bet you there will be more to come. Commissioner Merman, you had another question?
No, thank you. Sorry, forgot to put my hand down.
That's the last question we had, Dr. Holt and Mr. Wagner. Thank you very much. We appreciate it. Ms. Beck, County Attorney update.
Yes, good afternoon, Chairman Miller and board members. In reverse order, I'll just mention quickly, we've previously provided this to the board, but since our last meeting, the Governor DeSantis issued Executive Order number 20-211, which is simply a limited extension of the mortgage foreclosure and eviction relief, and that now is extended through October 1. And then the second item is the extension of our order regarding the local state of emergency, which, as you know, can only be extended at 7-day increments. And at this time, Mr. Chair, it would be appropriate to entertain a motion on that order.
Is there a motion?
So moved.
Motion by Commissioner Overman, second by Commissioner Smith to extend the emergency order. Any discussion? Seeing none, please call the roll.
Miller,
Yes.
Hagan, Kemp,
Yes.
Merman,
Yes.
Overman,
Yes.
Smith.
Yes.
Motion carried 5-0.
Thank you. Anything else, Ms. Beck?
No, sir.
Thank you, Ms. Beck. Anything to come? Anything else to come before us today? Anything else to come before us today? Seeing none. Okay, so Commissioner Merman, you recognize.
I just have one question. We're getting to, September is going to go by pretty quick, and October 1st is going to be upon us when we're back to, we won't have be able to do virtual meetings any longer.
We don't know that yet.
Our numbers are, yeah, I know, that's true. Our numbers are still kind of high though, and I wondered if it's prudent to send another letter to the governor's office requesting an extension.
Well, you know, I'm in favor of sending a letter.
Feel.
I'm in favor
I'll
of it.
support that effort. I'm in favor of it.
So,
we can wait for another couple weeks, I guess, but I think we need to start thinking about where we're going to land on October 1st. If we still have 200 cases or more, a day, I think we're still in kind of a widespread transmission mode, and, we just have to be very careful. And I know you, especially yourself, Mr. Chair, needs to be careful too.
Oh, you bet your bottom dollar. No, let me say this. We just heard Dr. Holt say that he anticipates, Dr. Holt, if you're still there, I'm not saying that you're guaranteeing this. I just heard he said that he anticipates with school opening and the Labor Day weekend coming up, that in 2 to 3 weeks, we might look at another spike there of cases coming up, and that's just about the time the month ends. I have talked to Ms. Wise, and Ms. Wise is on here. She and her staff are diligently preparing in case the governor does not extend the virtual meeting order. However, with what Dr. Holt just said and what we anticipate, I would feel better, and I know Commissioner Over would feel better, and some of us would feel better, that we send this letter to him as soon as possible, asking him to extend the virtual meeting order. They open up schools, and every day, and it sounds like one of the schools or some of the schools in every county has 10, 15, 20 cases coming out, and then they're having to quarantine one class, one school, 100 people. One school, the entire administrative staff had to be quarantined, had to bring in supervisors from the county to take care of it. So I will be inclined to do that as soon as possible. I see some hands. Commissioner Merman, you want to say something else? I see your hand.
No, I'm sorry.
Commissioner Smith, you recognize.
Thank you, and thank you very much. I think, I agree with everything that's been said so far, and the points that Commissioner Miller made about and Dr. Holt made about waiting to see. We might expect a spike 2 or 3 weeks after opening schools, and all I would add to that is that we know cruise ships are dangerous. We know nursing homes have to be particularly careful. We know concentrated crowds like bars are particularly dangerous. Schools, we can expect to have a spike in cases, but office buildings as well are often listed as one of these kinds of places where you've got people gathering in for long periods of time in meetings where people are talking and interacting with each other in confined spaces of our elevators, our hallways, as well as our meeting rooms and small offices. So I think it would be prudent to see if the governor will allow us to see how, learn from what happens at schools before where our community is before we begin opening an office as building as large as county center and having those public meetings and exposing the public to any further risks which might be compounding the community spread that could come out of school. So I think I would certainly be supportive of a cautious effort and making sure we could get the governor approval, the state approval for extending the period of time we're allowed to meet virtually.
Commissioner Kemp, you recognize.
Thank you. I also would support that effort for anything we can do right now. We just heard today, to me, not surprising at all, that even though I'm very happy that we've had a downward trajectory for the last couple months, and I think it's due to the mask ordinance and to people getting a message about what's dangerous and how we have to really, the community is doing this by working together to protect one another and to be careful and safe. So we have steady gone down 6.81, I think you said at the beginning there, so just under 7%. Positivity rate, we're stalled. Schools and other districts have looked for a 5% or lower positivity rate, 3%. New York City was looking for 1%. So we're stalled way above that. I do expect it to go up because we have opened our schools and given a message to the community in ways that it's okay to do this, to start opening up again. And I think anything we can do to tamp that down will be preventative, will help, will be a message that we should give about staying safe and careful. And I think, unfortunately, I think we're going to see, increases in coming weeks to come. And that's really, that's really tragic because I don't think needed to go there. We could have done other things at least to get this down a little bit further. So I'm totally in support of a letter. I wish we could be as protective of everybody as we are of county center and of the staff, but of the public coming here. And anything we can do is a positive thing in that direction. Thank you.
Commissioner Smith, did you have something else you want to say? Commissioner Merman, is there anything you want to do now?
I would just make a motion to go ahead and send a letter. Prepare a letter.
Is there a second?
Second.
There's a motion by Commissioner Merman, and a second by the rest of the county commissioners, including myself. Is there any discussion? No discussion on the motion. Please call the roll.
Miller,
Yes.
Kemp,
Yes.
Merman,
Yes.
Overman,
Yes.
Smith.
Yes.
Motion carries 5-0.
Okay. Any other items to discuss? Any others? Seeing none, everyone, look, we have a 3-day weekend, a holiday weekend. Please be careful, stay safe. If you must go out, wear a mask and social distance. If you don't have to go anywhere, stay home, barbecue at home or whatever you're going to do there, and enjoy your families. Families are vitally important. This week, Representative Diane Hart lost her son to a massive heart attack. He was 44 years old. We don't know, when these things are going to happen to our family members. Hold your family tight. They're vitally important to each and every one of us. So be careful, and I care a lot about each and every one of you. With no further discussion, we're adjourned.
Thank you.
Thank you.